I was being screened pre-surgical for a sinus operation. They discovered I did have lung cancer, immediately scheduled me for removal of a third of my right lung. Went amazingly well. I was out of the hospital in 3 days. Candidly, the screening process saved my life.
I was scheduled for knee surgery, and so I had an x-ray done as part of the pre-surgery process. And then through all of the testing and a biopsy, it was finally revealed that I had lung cancer. Unfortunately, the screening process wasn't available then, as it is now, which I strongly encourage people to partake of.
Here at the Norton Thoracic Institute at St. Joseph's Hospital, we perform lung cancer screening. Our goal is to identify lung cancers early to provide the optimal care for patients and hopefully offer them a cure to this devastating cancer. It's expected that this year over 220,000 people will be diagnosed with lung cancer. When someone's diagnosed with lung cancer in an early stage, stage 1, they have an 85 to 90% survival rate. Most of the time they're diagnosed at stage 3 or 4, and those patients have a 15% or less 5-year survival rate.
Here at the Norton Thoracic Institute, we have a nurse navigator and we have a lung cancer screening coordinator. They actually review all the cases that are sent in as referrals, and then we have a multidisciplinary board that includes radiology, radiation oncology, myself representing pulmonary thoracic surgery.
What I do is I navigate patients through the lung cancer screening and pulmonary nodule program. So what happens is our referrals come from primary care physicians, pulmonology. They'll send over a referral, I'll contact a patient, and I'll screen them first to make sure that they qualify for the program. And once they qualify, we'll set up a CT scan of the chest. Once they have the CT scan done, radiology will contact us and let us know. And then we have a tumor board meeting every Friday that consists of multiple specialties. So we'll review their films at that meeting. Then we come up with a plan and we contact the patient and the primary care physician and let them know what that plan is.
Once they meet the entry metrics, they get an appointment, they present themselves at our outpatient imaging center, they come through registration, our techs bring them into the room, explain what's going to happen to them, which is essentially lie on the table, take a deep breath in. It takes about 7 seconds to scan through your chest. We use low-dose CT technique, so we've toned down the amount of radiation that our scanners produce to further decrease the potential side effects of radiation. As a consequence, we're increasing the likelihood of the scan being a positive thing for the patient.
We've actually celebrated for now 6 years. This is my 6th year. Last year was the banner year because it was the 5th year which time I was declared cured. I am passionate about it because most of the people that I have talked to have lost someone to lung cancer because by the time it was discovered, they were already at stage 4. So now there is a screening process. So I would encourage people to partake of that opportunity, and I understand that it is covered by insurance. And to tell you the truth, even if it wasn't, even if it's a couple of $100s or so, what's your life worth?
You're out of your mind if you don't take advantage of this service. They just made the whole process smooth. They never gave me a sense of fear, a sense of nervousness. From the doctor down to the nurses, it was a reassurance that I was going to be okay. And I am.